Sean, talk to me about the protocols that you use through IMC in your clinics. I mean, is there the protection of healthcare workers? Is it about the kind of gear? Is it about the protocols that are in place? The simplicity of the training? What?
Right. It's important to have the right gear. We use the same standard as Doctors Without Borders, tie-chem suits with separate hoods, 3 pairs of gloves in some cases. But the most important thing is how you take it off, really. And that's up to 20 steps that have to be followed sequentially. It has to be supervised. And so we have safety inspectors who watch our staff doff their personal protective equipment. So they call out every motion.
Those protocols were not in place clearly early on at this hospital here in Dallas. And the protective gear they were using is not as advanced as the protective gear you were using. Your clinic's been open for a month. None of your healthcare workers has been infected, but it isn't the most sophisticated medical facilities. That's what's interesting, because I think a lot of people assume, well, a hospital in the United States treating an Ebola patient, it's an extremely sophisticated facility, but that's not necessarily what's going to make the difference.
No. Our Ebola treatment unit here in Liberia is in the forest, actually, down a dirt road next to a leper colony. And we've had over 100 patients in the last month since we opened, and our staff are safe. It's really not the sophistication of the equipment that we have. It's just about following simple protocols, about how the equipment is put on, how it's taken off, and how we move within the Ebola treatment unit to not contaminate ourselves and to keep our hands clean.
So does it surprise you the problems medical workers are having in the United States, at least at this hospital?
Well, it's not entirely surprising, because I think our staff have actually had more training than some staff would have in the United States, because we're trained to do exactly what we're doing. This is all that we do here.
You know, Sean, there's been talk here in the United States of travel bans, of stopping commercial flights. Do you have a problem keeping staff, getting staff in and out? Because that's one of the arguments against some sort of an all-out ban, that it would make it more difficult for aid workers to come back and forth.
Yeah, the international air connections are critical for our staff, our volunteers, and our supplies to get here. And there's a physical issue and a psychological issue. The physical issue is that we need to move bodies and supplies to get here. And if we don't have those flight connections, that becomes much more complicated. The psychological barrier is we need people to feel confident coming here. And if they're not sure that they're going to be able to get home, it's harder to recruit and it's harder to retain.
I've heard some aid workers say, look, there just needs to be a greater footprint on the ground. There needs to be more personnel from more organizations, from more countries, from governments involved, money that's being donated. There just needs to be more on the ground in these countries. Is that what you're seeing as well?
Yeah, we need more of everything, actually. I mean, you've been in the Philippines and in Haiti after disasters in those places, and there's a rush of organizations and aid workers within days. And here it's been months of trickle. We just don't have enough hands on deck. There aren't enough organizations. Some of the resources are starting to come in, but this is an enormous task that covers multiple countries. It requires technical expertise, infrastructure, all kinds of things that have to happen simultaneously, and we're not moving fast enough.
Sean Casey, I appreciate all you and your organization are doing. Thank you so much.
Thanks.